I'm Kathy Ballman, and I am an associate clinical professor here at the College of Nursing. I teach the acute care nurse practitioner programs. I am the coordinator for the program. I also work as an acute care nurse practitioner at the University of Cincinnati Medical Center. I am part of the cardiovascular nurse practitioner unit there, and I work very closely with multiple physicians ranging from general cardiologists to interventionalists to electrophysiologists.
Can you tell me about some of your roles and responsibilities as an advanced practice nurse?
Sure. In my practice, in the cardiovascular practice, I admit patients, typically after they've had some type of an event or procedure. Mostly those that come in that have cardiovascular disease, they come in to have angioplasty or they receive a stent. We may have patients who have dysrhythmia and they come in and they have a cardiac ablation. Or we may have some other folks with some other kinds of different dysrhythmias, and they need pacemakers, or they may be someone who have end-stage cardiovascular disease and they are now in heart failure and they need some implementation such as a biventricular assist device.
And how would you say that you use biostatistics to influence your professional practice and patient outcomes?
Well, Gordon, as you know, a medical practice changes almost momentarily. In the cardiovascular world, that is true as well. Many protocols, many clinical practice guidelines change very frequently. And to keep up with standards of care, you really have to use your evidence-based practice, and you have to know biostatistics to be able to really take a good look at the evidence that's out there. You have to be able to see if it pertains to your patient, and you have to see if it's usable or if it's good quality evidence. So, pretty much on a daily basis as an advanced practice nurse, I am looking for new guidelines. Our medications change frequently, especially with anticoagulation. There's new products out there, and we have to really take a look and weigh whether or not our patients are appropriate for these new drug treatments. So that really is a big issue there. The other that I do almost every week is when I'm lecturing or teaching different areas in the acute care nurse practitioner curriculum, I am constantly looking for updates and changes into guidelines, protocols, and new evidence that's out there. So I am looking at new studies constantly. So I am always using biostats. I can tell you when I took it in my doctoral program, I thought, oh yeah, okay, I'm not going to really use this. Why am I doing this again? I already had statistics in my master's program. But it really made it very clear how we have to use evidence-based practice, and we have to be able to read and analyze the evidence that's out there.
Can you give me an example of, you had mentioned anticoagulant therapy. Can you give me an example maybe from that where you're using the evidence to influence your practice?
Absolutely. In years past, when we have folks who need chronic anticoagulation, we always used warfarin. And warfarin is a medication that causes lots of variable side effects. It has to be monitored for its level, and to do that you have to have a patient that's compliant. They have to go in and they have to make sure that they have their blood levels drawn, their INR. If it's too low, they're subtherapeutic, meaning that they are at risk for clotting or stroke or heart attack, or if they're hypertherapeutic, they're at risk for bleed. So they have to stay on a straight and narrow. Now there's many other drugs that are out there that can be used in place of warfarin. What I have to do is make sure that I know the evidence for the particular patient population that is out there that would benefit from using other drugs besides the warfarin.
And how would you decide if those drugs would be potentially as effective as Coumadin or warfarin?
What you would do is you would take a look at the data, and mind you, the drug companies provide you a boatload, and a lot of it may be biased, so you sort of have to take that for granted. But then you can go in and take a look at multiple clinical studies that are out there, and to just give a plug for the advanced practice nurse, you need to belong to organizations and associations that monitor the research that's out there. I get daily new evidence-based research coming across my computer telling me, really we don't really need to use this new drug on that patient who has had a TIA in the past and they're over 65 and so on, because these drugs cannot be monitored closely like the warfarin. Plus, we also look at the cost, so it's cost efficiency too.
Okay, is there anything else that you believe graduate nursing students need to know about biostatistics as they become future advanced practice nurses?
Yeah, as a matter of fact, there are many, like I said just before, there are numerous ways that you receive information, advanced practice information, and you take a look at many different studies. And many of the studies are reputable, they're good, they have great power, they have a good amount of enrollment, and they come out with some great evidence to perhaps change practice. Within the last couple weeks, there's been many articles out about using the drug colchicine for pericarditis, for acute pericarditis. We use it in practice. Our guidelines say that we can use it as a secondary type medication if the normal medications, the NSAIDs, are not working. This new article that came out that looked at a study, it was actually done in Italy, came out with great results. It was a good study. It was put into a reputable journal, the New England Journal of Medicine. And you think about, well, should I change my practice? But what I have to caution advanced practice care providers is this is not a labeled medication to use for acute care pericarditis in North America. So, if you're thinking about going off-label using this drug with acute pericarditis, you really need to have consultation with your collaborative physician, because you cannot use medications off-label even if the evidence proves that it is beneficial. So that's just a caution.
All right, is there anything that you'd like to add today?
I think for those of you who are skeptical about biostats, I think you need to embrace it, and you need to learn the language, and you need to use it every day in your practice.